Well, at-home genetic testing can be a fun way to learn about your family history, but you might want to be careful about health results that you get.
Samantha Sonner has the story.
Knowing if you're at risk for certain cancers should help you prepare for them, right?
They're doing the tests that they can do because they can do those tests. Those are not necessarily the tests that you need.
Dr. Stephen Mamis says at-home testing doesn't give you a full picture of your cancer risk.
The majority of cancers that we know are not caused by a gene, by a mutation, something that you inherit. They're acquired problems. So the fact of the matter is a gene test, by definition, is going to pick up a small proportion of patients who potentially might be at an increased risk for developing cancer.
Most cancers that can be tested for through genetic testing are very rare.
For something called hereditary amyloidosis, which is extremely rare, and in 40 years I've not seen a single case. So effectively 99% of cancers are really not tested for by this particular testing system.
Testing for the BRCA gene could be helpful for some women. But if the test comes back negative, it could give some a false sense of security.
The overwhelming majority of breast cancers are not due to BRCA1 or BRCA2, which are hereditary predisposing gene abnormalities. And the majority of women who do develop breast cancer do not have an obvious genetic cause for it.
Dr. Mamis says if you are going to do genetic testing, you definitely still need preventative screenings.
You really would be much better off getting a mammogram and doing screening as recommended, say, by the American Cancer Society.
And you should continue to talk to your doctor about your personal risks, regardless of results.
If you come back with a test that says you have a low risk for something, whether it be heart disease, whether it be diabetes, that doesn't mean no risk.
To know which screenings you should be completing, you should talk with your family doctor.